Welcome. My name is Mary Doyle, and I'm a senior research associate in the Department of Environmental Health Sciences in the Johns Hopkins Bloomberg School of Public Health. I direct the continuing education and outreach programs in the NIOSH-sponsored Johns Hopkins Education and Research Center for Occupational Safety and Health. I'm a nurse by training, and I'm certified in occupational health and case management. In this section, we're going to look at the individual factors that predispose worker populations to be vulnerable and the impact on total worker health. At the end of this module, participants will be able to cite individual factors that predispose one to vulnerability, describe how these individual factors can increase vulnerability as a worker, and recall how the judicial system has sought to compensate vulnerable workers who were abused. Some individual factors that predispose one to vulnerability are where you were born, your age, where you currently live, how much you earn, your physical and mental health, your skills and education, and the type of work you do. There are about 26.3 million U.S. immigrant workers in the U.S. in 2015, and that represents 16.7% of the total workforce. There are about 160 million people in the total civilian workforce. Hispanics comprise 48.8%, Asians are 24.1%, and they are overrepresented in frontline workers such as doctors, nurses, pharmacists, custodians, home health aides, clerks, etc. By 2060, the immigrant workforce in the U.S. will be twice the native-born workforce, and the highest growth is expected among Hispanics. 8 million workers in the U.S. are undocumented, and this is about 5% of the workforce. These are largely in agricultural settings, and 25% lost their jobs in the pandemic. Due to their undocumented status, no benefits were available from the American Rescue Plan. Age is another factor. Children as young as 10 years old can legally work on non-family farms. These jobs are high demand and low control. It's precarious work, and there are very high injury rates among young workers. Young workers represent about 12% of the workforce in 2019. Functional capacity begins to decrease at age 30, so both physical and mental capacity. And literature defines the aging worker as 45 to 50, which doesn't seem that old. The International Labor Organization estimates 40% of the U.S. workers will be over 55 by the year 2030. Where you live is an important consideration as well, whether you live in an urban setting or in a rural setting. In a rural setting, there may be poor, immigrant, and non-white workers who are more vulnerable to wildfires. Rural communities are more vulnerable to infectious diseases like COVID-19. They may have more comorbidities. They're an older population. Many of them have no health insurance, and there's a longer distance to critical care hospitals. 20% of the LGBTQ community live in rural communities. In an urban setting, there are challenges in transportation, in the effects of climate change and air pollution, and the comorbidities that go along with the exposure to those toxins. Food sources, such as food deserts, may be in place, and it's difficult to find fresh fruits and vegetables or even a grocery store that's close to them that they can reach on a public transportation, and also a lack of green space access. So there are issues in both rural and urban communities that we can see. Your income is influenced by where you were born, your age, where you live, obviously how much you earn, your health, your education and your skills, and the type of work you do. Your health is influenced by the zip code that you live in. Again, we talked about some of the environmental factors that are both in rural communities as well as urban communities. And depending on the zip code you live in, you may have a lot more air pollution. You may have toxic waste in your community. So by zip code, it very much affects your health. Your lifestyle, any pre-existing conditions that you have, your wealth. Someone obviously who has more wealth can afford to have regular checkups. They can afford surgeries. They can afford different medications to treat their conditions. And then their access to medical care. Again, your health is very much determined by your access to medical care. So education and skills. New and uneducated workers perform the riskiest jobs. They tend to be the youngest workers without the skills. These were identified as essential workers during COVID because they were the food service workers, they were the agricultural workers that had to come to work every day. Even highly skilled immigrants tend to have low-level jobs due to language skills and job and licensing requirements. There are a lot of people who came over to this country. They were doctors in their country, they were lawyers in their country, but they can't sit for the bar or the medical boards because of the language barrier or because of the educational requirements. So they have to take lower skilled jobs. So education and skills can reduce worker vulnerability. The degree programs and certificate programs, on-the-job learning, trade schools and certificate programs all can teach an employee a valuable skill that they can move up in the job ladder. So different types of work. We talked about the 3Ds, the dirty, dangerous, and demeaning jobs that had no benefits. And these are found to be high-stress, low-control jobs. A University of Indiana study of 2,300 Wisconsin workers in their 60s in high-demand jobs. Those in low-control jobs, in that they had no say over the way the job was done, had a 15% higher risk of death. Those who had high-control jobs, in that they did have a say in how the job was done, they had a 34% lower risk of death. And cancer was the leading cause of death in 55%. Circulatory system, 22%, respiratory system, 8%. 33% of the deaths were in manufacturing and 26% were in frontline service workers. So there have been many studies that show this high stress, low control has a very serious effect on our health and on our risk of death. And so this is something that a lot of employers are looking at in ways that they can change the job functions and that give more control to workers over the way they do their jobs. One of the first researchers who talked about this job demand control model was Karasik. In 1979, he developed this model of job demands versus job decisional latitude. So on the x-axis, you can see that it goes from low demand on the left to high demand on the right. And on the y-axis, job decision latitude goes from low to high. So somebody has very low demand and has very high control over their job, they have very low stress jobs. Conversely, if somebody has very high demand and very low control, then they have high stress on their job. So the most stressful jobs are high demand, low control. This leads to significant psychological stress. This person has no ability to make any decisions about their job, and this leads to disease and health effects. The job demand control support model here shows how support from colleagues and supervisors can buffer stress. Increased control over one's job and interventions that promote worker psychological well-being also reduce stress and can increase job satisfaction. I wanted to tell you about a case study from the EEOC, the Equal Employment Opportunity Commission. There was a farm in Adalisa, Iowa, called Hill County Farm, which also was doing business as Henry's Turking Service. So it was a poultry processing farm. And they had 32 intellectually disabled workers ranging from age 40 to 60 who worked on this farm. So they worked in an old schoolhouse, not in a formal processing plant. So there were probably some environmental and occupational hazards there as well. These intellectually disabled workers were paid only $2 a day for decades, and they were subjected to verbal and physical harassment. They restricted their movements and provided inadequate living conditions. They were denied medical care by their employer and caregivers, and they had very few advocates for them. And EEOC was brought in, and they sued for exploitation, and they won a jury award of $240 million against Hill County Farms that would serve to compensate these employees for their years of abuse and neglect and would also provide for their future care. There's another case study on immigrant workers in an Oregon marijuana farm. In 2021, thousands of immigrants were working on an illegal marijuana farm run by foreign drug cartels. Workers were brought here and were forced to work for little or no pay. Many were here without documentation, so they had no legal recourse. There were threats of violence against the workers and their families if they did not comply. Living conditions on the farm were extremely poor. They had limited access to food and cooking facilities and inadequate water and sanitation. Authorities are overwhelmed by the volume of these industrial-scale facilities in rural areas, and law enforcement has difficulty locating and enforcing the law against these types of situations. So it's people that are really taking advantage of people that are here, that are undocumented, but our economy really relies on these workers. So it's something that we have to address. So thank you for your attention on this module. I hope you got a little information on who our vulnerable workers are and some of the case studies about these workers. Thank you.